tell me what to do. The simple thing is wash your hand. Teach him how to wash his hands. And also how to wash his mouth, how to wash his nose, how to take a bath, like that.
I think this is something very important, just you have mentioned,
Especially
talking
in our
about,
country.
yes, in our country, we're approaching winter time, and basically I care about our children.
In winter, people think that common cold is one thing. No, for me, common cold is 200 virus. Number one, two of these viruses, one of them is 80, is subgrouped into 80 group, another 150. So we have about 300 causes of virus in our society in winter. So if you just teach them how to wash the hand and how to sneeze. Sneezing is very important. Sometimes they sneeze in the hands. Not accepted. Don't sneeze in your hand, because if you sneeze in your hands will become contaminated. You will shake hand with me, you will infect me, you will shake hand with the other. So for me, don't sneeze in your hands, and for me, wash your hands, and for you, I'll wash my hands like that. If you, for example, you are in an elevator and it attacked you, because if you have common cold or allergy, you have to be prepared. You have a lot of tissue beside you, in your pocket, or your bag, that you have a sneezing attacks common. So you are in an elevator. You have to give your back to the people, and you can sneeze on your elbow, the best in your elbow, because the elbow not contaminates the others. But if I sneeze on my hand,
But still it would carry
in
some microbes and
do not touch.
to give them your
Do not touch. No, and if it touch, it will touch a shoulder, it will touch a clothes.
it will touch my child, for example, if I just carry my child, and this is something important as well.
If your child touches his by his fingers, maybe. But for us, the ideal and the practical way to sneeze in your clothes or on your elbow is very practical all over the world. Do you agree about this? And if you sneeze in your hand, you have to wash your hand thoroughly. And the problem that 50% of us don't wash their hands when they sneeze. They will continue their work, they continue to shake hands, and sometimes they kiss each other, greet each other by this, and you spread the infection from one to one. The problem, you can spread the infection to another one who have low immunity. For example, a common cold with me will be just 10 days, 2 weeks. The other will have bronchitis, the other will have pneumonia, the other will have fatal disease, meningitis or encephalitis from just common cold.
So it will affect people differently. But then again, because what we see now is that the level of awareness so far is very poor. So what are the techniques other than telling a friend, other than telling people? Do you know of any government campaigns that are being, or especially in university, for example, Ain Shams, are there campaigns to promote that sort of?
Yes, we are doing
On
this.
schools as well.
Especially in schools.
Yesterday I was in a school, and I think every
Private or public?
Private.
This is the main issue, because I was sure that you're going to say private. What about the public? Because I'm basically concerned about the public.
Governmental schools also, but I think the whole, maybe I have 100 lectures per year scheduled in 6 areas in whole Egypt, covering the schools and this covering institute and university, and also you have to take care of the views or the power of the political and the religious views in Egypt now. We have to encourage the political parties and the religious leaders to campaign with us, the church and the mosque. They have to say this in the mosque and the churches. Take care of your health, wash, be clean, like that. We need it.
And how can we improve our immunity system?
Number one, by health education. We are grateful for you today. You are helping us. Health education. We need health. We are poor in health. We are ignorant in health. All of us. We need education. Number one. Number two, by proper nutrition. Proper nutrition. Very simple. If you remember just the name of face. Food. By food, you can change your immunity. So you have to be far away from the modern food of this 5-star restaurants, junk food and this. And you have to remember vitamin A. Vitamin A is very important, not only for vision. Vitamin A for immunity. Vitamin A will protect the orifices. These orifices, nose, mouth, and eye. These are the 3 orifices on my skin which allows the microbes to enter. Sometimes I cooperate with the microbes to enter in my body by touching. So before the children touch their nose, sometimes 80 per hour, the other 16. So you have to wash your hands, number one, and you have to take care of the orifices. The best vitamin to take care of the orifices and the mucosa inside this is vitamin A.
And where can I find the vitamin A if I'm talking about?
Carrot, sweet potato, all greeny leaves you can find beside you. Number one. Number two is C. Vitamin C is very important. People think vitamin C is present only in lemon or the orange. No, you can find it in guava, in kiwi, very high concentration compared to lemon and orange. And the problem of vitamin C, it is destroyed by smoking, even passive smoking. So you have to take it daily. And if someone smoke in front of me 2 cigarettes, it will destroy my store of vitamin C. So you have to take vitamin C daily, not frozen, not cold, not boiled. So it must be fresh. The best is kiwi or guava. After this, vitamin E, you can have to find, I think the Egyptians don't eat olive and olive oil. There is lack in this, and lack also in fish. So you have to look for this. It's very important, increase the immunity. Also, you have to be far away from the drugs we are swallowing every day. We are thinking now about common cold and virus and influenza and this, but the majority of infection now in our life due to viruses. Antibiotics are against bacteria. So if you take antibiotics and you have virus, you're wasting your time and your mind and your life. So no need for antibiotics for all.
Not to take antibiotics responsibly.
And analgesics also without the prescriptions, permission of a doctor. And be far away from smoking. And please take care of your cleanliness in the street and your work and like this. Because if you leave your garbage in the street, okay, it will be in the street far away from house, your house clean. But after a few days, you will find cockroach. Cockroach will give a lot of secretions, and the eggs will give a lot of powder. The powder will smell, and this will make allergy and increase allergy. And allergy in Egyptian children in chest is 10%, allergic rhinitis 20%, just because you leave your garbage in the street.
Well, Dr. Magdy Badran, consultant and professor of allergy and immunology, and a fellow of the Graduate Institute for Childhood and Motherhood at Ain Shams University, we'd like to thank you very much for shedding light on this extremely important issue.
Thank you very much. Moving on to a break, and we'll be back.